Today's topic is change, not chains. And we have a good panel for you and a moderator, which I'll introduce here in just a moment. My name is Adam Riley, and I am the prevention manager at Caracol, the AIDS service organization for Southwest Ohio. I'm also a member of the Ohio Health Modernization. Our mission as the Ohio Health Modernization, we are a coalition of organizations and individuals dedicated to ending the criminalization of HIV in Ohio. We are mobilizing a broad coalition, including individuals and communities who are disproportionately impacted by HIV, to replace fear-based stigmatizing laws that criminalize HIV status with evidence-based, non-discriminatory laws that protect public health. Organizations that are part of OHMM include AIDS Task Force of Greater Cleveland, the AIDS Healthcare Foundation of Ohio, Canopy, Caracol, Equality Ohio, Equitas Health, and the University of Toledo College of Medicine. Before we get started a little bit, what to expect today, we're just going to talk about how these laws are stigmatizing and how some other states have addressed laws that are similar to what Ohio is currently experiencing. We also want to make sure that you sign the pledge. One of our goals today is to get a pledge signed on social media, learn about how urgent the need is to modernize Ohio's law, sign this pledge. We need support, and the time is now. And then share this on your social media and with your networks, and hopefully encourage other people to sign the pledges. So you'll see all of the hashtags that we're using on social media. I'd also like to let everybody know about an upcoming event OHMM will be having on December 14th. We will have our monthly webinar educational series. And on that day, the topic will be the human side of HIV, use science to combat stigma. We will be offering continuing legal education credits, so CLEs, at that, and we hope that you can attend. And with that, I think I will turn it over to today's moderator, who is Bryan Jones, an international advocate and activist. And I think you guys are in for a real treat today with him leading this conversation. So Bryan, take it away.
Hi, my name is Bryan C. Jones. I guess is my camera on? It doesn't appear to be on.
It is on.
Okay. I just have to make sure my foundation is right for that. How's everyone doing? My name is Bryan C. Jones. I'm a person who's been thriving with AIDS for 38 years. And we're just going to jump right into this conversation. Today we are doing a comparison of several states, Illinois, Nevada, and South Carolina. Is it South Carolina? Gleason. North Carolina. Thank you, JM. So we're going to be doing a comparison, and I have three friends. I brought three friends along to help do this. First, I want to introduce Timothy Jackson. I first met Timothy Jackson in Alabama at HIV is Not a Crime Training Academy. Hi, Timothy. Can you come on and tell us a little bit about yourself?
Sure. Thank you so much, Bryan. And thank you all so much for joining us today. It's an absolute pleasure. As Bryan mentioned, I was originally living in Alabama when he met me, but now I am proud to serve as the Director of Government Relations for AIDS Foundation of Chicago, where we were able to repeal our state's law criminalizing people living with HIV. So looking forward to the conversation today.
Okay, and next we have is, we were going to do Michigan, but Shanika Adams unfortunately could not make it. But we have a wonderful advocate out of Nevada. Her name's Connie Rose. I first met Connie Rose at HIV is Not a Crime in Indiana. Connie Rose, can you come on and tell us a little bit about yourself?
Sure, Bryan. Thank you again for the invite today. My name's Connie Rose. I live in Las Vegas, Nevada. Originally from Indiana. I have been living with HIV for 25 years. I'm the co-founding chair of the Nevada HIV Modernization Coalition, and we were also successfully able to reform our laws during this session, and I'm excited to be here to talk about that. Thank you for the invite.
Okay, thank you for that, Connie Rose, and much appreciation for stepping in. The next guy is Terrell Gleason, who I've known for a number of years. I first met Terrell at a NMAC, National a national conference on HIV and AIDS, sponsored by MMAC years ago. So Terrell, come on and tell us a little bit about yourself.
Hello, everybody. My name is Terrell Gleason. I'm in Greensboro, North Carolina. I'm part of an advocacy organization called Advocacy House. We were the fourth state in the country to change our laws. Thank you for having me here today, and happy World HIV/AIDS Day.
Hey, thank you so much, Terrell. And our own Zach McCune is also going to be on this panel, and he'll be doing a comparison about Ohio's laws with these other modernizations in these other states. Zach, can you come on and tell us a little bit about yourself?
Yeah, thank you, Brian, and thank you everybody for being here today. My name is Zach McCune. I use he, him pronouns. I'm the Associate Director of Public Policy for Equitas Health, a regional healthcare organization here in Ohio. And I'm really excited to join the conversation and learn how best we can apply the strategies that you all have used to win and to modernize and repeal the laws in your respective states, and see how we can learn from you all along the way.
Well, thank you for that, Zach. We're going to have a real open and candid conversation here with each of these states. Also, feel free to jump in, put something in the chat if you have a question that you need answered or a comment. Feel free to put that in the chat and we will address it if time permits. But before we get started, I want to first talk about California's modernization of their HIV law, which many point to as being one of the better modernizations of the law. Can we pull that slide up, those talking points up? California modernized their law in 2017. It went from being a felony to a misdemeanor. And one thing that it did do was it drastically reduced the penalty. A person under the old law could be convicted of 3, 5, or 8 years of incarceration. Now, they can only be convicted of 6 months. And actual transmission has to occur. It also allows for medical safeguards, such as if a person is on antiretroviral medication, and it uses that, or if a person used a condom, or if the person partner was on PrEP. But even if a person didn't do any of those things, the prosecution still has to prove intent. And the good thing about this California law is they make it, I won't say impossible to prove intent, but they make it extremely hard for the prosecutor to prove intent. Because even if a person was not on antiretroviral medication, that alone is not enough reason to prove intent. So it makes it very hard to prove intent. Also, it changed the enhancement for sex workers. I don't know if y'all can see these talking points. I don't know if y'all have to excuse me. This whole webinar thing is like childproof for me. I need an adult to help me do it. But it also removed the enhancement for sex workers. But what remained in place was the penalty for sex crimes. The statute that dealt with sex crimes remained in place. Also, they began to prosecute under a misdemeanor, under their health codes. But the thing about the health code is it's a lesser degree of intent that needs to be proved, but still the person can only be convicted of up to 6 months in prison. Another wonderful thing about this law is it has protection for people living with HIV and AIDS, because the person who may be lodging the complaint, as well as the defendant, their information is not readily released to the press. And that's always a problem, because if the person is found not guilty, their information has been released to the press, so they've been persecuted through the media. So these are some things about California's law, and trust, I'm not a lawyer, so I try to point out some points that me as a layperson was able to relate to and why this was really good. But I think what really grabs you here is that intent portion. Another thing that I think one of the things that people have to look out for is that when it comes to their health codes, they talk about willful intent. And I think that's what everybody's going to be looking at, that piece and how that is interpreted. And in California now, HIV is not singled out as a dangerous disease that can trigger a felony prosecution. So another complaint that people have had about the California law is that it seems to be very broad in talking about communicable diseases now. And that can include tuberculosis, emphysema, all these things. So I think that's another setback from that. But aside from everything else, I think these other changes really help people living with HIV and AIDS. It is probably one of the better modernizations to date. Zach, do you have any comments on that? He's more a legal mind than myself.
That was a great summary, Bryan. Thank you so much for providing that. And I don't have too much to add, and I will disclose I'm also not an attorney. I've just been practicing in the public policy space for a while. So anything I say will not be legal advice. We can direct you to some great attorneys through Equality Ohio and a network of advocates. But I just wanted to add that any attempt that we'd like to see here in Ohio needs to also require intent and actual harm for any sort of law to potentially stand in the future. So that's something you'll see us advocate for here in Ohio, is making sure that those elements are also taken into consideration as well. So that way, if a person living with HIV cannot be prosecuted under a statute just for a failure to disclose if they had no intent to cause harm or if no transmission actually occurred. So that's something you'll see our coalition continue to advocate for in any proposed legislation to modernize the laws here in Ohio.
Well, I think that's great. And one last point is, usually medical safeguards, such as being on medication, have not usually been allowed in the courtroom that we have seen. But the first time I remember it happening was in Arkansas with the guy, Sanjay Johnson, who was being charged. And they allowed the fact that he was virally suppressed to be allowed in the courtroom, essentially U equals U. And that was the first time I had actually witnessed them actually allowing scientific information or discovery into the courtroom. So we're going to get started with Timothy Jackson from Illinois. Mr. Jackson, are you ready? Put you in the hot seat for a few minutes.
Sure, absolutely.
So can you just tell us about your law? Give us a brief overview of your law. And
Sure. Our initial law was passed in 1989, of course, like many others across the country that were put on the books as a really kind of a requirement to get a prerequisite, rather, to get federal funding through the Ryan White CARE Act of 1990. And so that law was put on the books here in 1989. It was modernized in 2012. Where it moved from a felony to a misdemeanor. And so essentially what it did was really, as you mentioned about California, was the specific intent to transmit. However, the problem that we ran into is it's from 2012 up until earlier this year when I got the latest numbers, probably around February or March. 22 people still had been charged with this crime, even though it had been modernized. And so as the coalition began to work to determine whether we would further modernize this law, and I'm sorry, I misspoke earlier, it was still a felony, about whether we would further modernize, our law.
So it was still a felony when it was modernized in 2012?
Yes.
Okay.
And so basically the years had been reduced, is essentially what had happened. But it was still a felony. And so we decided that, as we talk about ending the HIV epidemic here in Illinois, one of the big things that we talk about constantly is stigma. And we felt that even if we modernize this, say down to a misdemeanor and reduce the years and reduce the fine and make some other changes, that this law was still on the books and was still stigmatizing. And so we made the determination that we were going to do a full repeal. And so over the past 2.5, 3 years, we did a lot of education to legislators, to community, literally from Chicago to East St. Louis, which, if you're familiar with Illinois, that's from the north to the south, the southern part of the state. And so, and all points in between. And so we made the determination about this time last year, actually, that we were going to advance legislation in 2021. And we were able to find 2 dynamic legislators that advanced this through session, and it was signed by Governor Pritzker on July 27th. And so right now it is a full repeal. The entire section is completely repealed, effective immediately. And it also went in and made changes to the AIDS Confidentiality Act here in Illinois that previously allowed law enforcement officials to get the medical records of people living with HIV. So they can no longer do that. And so that's where we are right now. And so that was a major part of repealing this statute, was a major part of our state's plan to end the HIV epidemic. And so naturally, as a person living with HIV for 12 years, it was very fulfilling, obviously, and satisfying to get it off the books.
Well, we do know that Texas was the first to repeal their law back in the, I think, 96.
94?
So, what was it?
94?
94, okay. So we know, as we look at this, the whole nation is watching with bated breath at Illinois. Did you have discussion, or are there any safeguards in place that will not allow people living with HIV to be prosecuted under general laws?
Absolutely. First of all, let me say this: Illinois is not Texas. And so we're talking about 2 completely different dynamics when we're talking about politics, political environments. We're also talking about something that was in 94. And obviously, a lot has changed in Texas from that time. And so, one, I want to be very mindful of that. 2, of course, there were conversations with the coalition, the Illinois HIV Action Alliance, on, again, as we determined what our next steps were to making sure that there are safeguards put in place. We are assembling a team of lawyers and legal professionals to safeguard people living with HIV here in Illinois. Our education with the southern part of me still comes out when I see district attorney, state's attorneys. We are still doing education with them. We are doing education with the Sheriff's Association, with the Police Chiefs Association. And our bill was passed in July. And we're still continuing with that education, and we will be doing so for the foreseeable future. And we are still, as a coalition, still doing education, outreach to legislators, even though this law is no longer even on the books. And so those are some of the safeguards that we have put in place that make sure that to really show people across the country that a full repeal, when done properly, as we're going to do it, it's definitely an option.
Kudos to Illinois for actually doing this and having the guts to do this and to step out and show that a full repeal can happen. I'm assuming this had bipartisan support.
Absolutely. We had overwhelming bipartisan support, especially in the House. 10 of the 12 Republican members of leadership voted for this bill.
And finding a champion for this bill, was it a hard road to toe, or was it relatively easy because Illinois seems to be a little more educated in terms of the law?
Well, I'm not going to say, well, Illinois, we made sure that the education was done. We literally did not leave a single stone unturned in the education that we did. We did not really find a very difficult time in finding a champion. The great thing is the coalition was made up of not only people living with HIV, but a lot of other large organizations, like the ACLU, Equality Illinois here, of course, AIDS Foundation of Chicago, and many others, Howard Brown Health, were all engaged. And so naturally, when you have some of these larger organizations that are at the forefront, you bring legislators that naturally are tied to many of these organizations that are supported. And so, but yeah, we were able to find two dynamic lawmakers in State Representative Carol Ammons of Urbana and State Senator Robert Peters of Chicago.
Well, thank you very much for that. Zach, I want to bring Zach in now. And Zach, can you have a comment as it relates to Ohio as well as Illinois, some comparisons that you might be able to point out?
Yeah, absolutely. So thank you so much for sharing, Timothy. That's really powerful to hear the story of how you all were able to modernize back in 2012, observe some of the changes that still needed to be made to the law, and then pursue full repeal this past year. And congratulations also on those efforts and your success in the state. So we hope to at least model some of that right here in Ohio with the coalition that we're fueling here with the Ohio Health Modernization Movement. So I wanted to point out a couple of unfortunate circumstances that we're presented with here in Ohio. Given the current structure of the legislature and the hyperpartisan nature, we believe that full repeal at this time may be something that we could potentially struggle with here in Ohio. We understand that we have a lot of education left to do, not only with members of the majority party, but members of the minority party in both chambers as well. So we are looking to really make sure that we have that industry support lined up. We have the direct support of the grassroots, people who have been living and thriving with HIV for many years, our large service organizations, businesses, healthcare providers, and entities to be able to come to the table together and ensure that we can also have bipartisan effort to modernize the statutes here in Ohio. And we understand that, the past year has also presented a very particular challenge for legislators, not only here in Ohio, but across the United States as well. When we're talking about the way that COVID has really been politicized and public health measures have also been politicized, we have to draw or walk a very narrow line to make sure that the language that's not being used to discuss the current pandemic is being repurposed in a way that gives new meaning or new urgency to criminalization of what are really just should be public health issues. So that's, I think, where a lot of our barriers have been in this present year, but understanding that on both sides of the aisle, we do have some really great advocates. We just need to make sure that we continue to get them the support that they need from their communities, from across the state, and also the education, the tools, and the resources they need to talk about HIV in an informed way that does not continue to perpetuate stigma and harm against people living with or at risk of HIV. So that is a challenge that we are well aware of, and are working to make sure that any effort to modernize or repeal the statutes here in Ohio have bipartisan support, because we know, frankly, and we've discussed, HIV is not a crime, right? This is something that is well within our power to handle, to treat, and to prevent in the future as well, and to make sure that we're supporting people living with HIV so they can live the lives that they deserve to live as well here in the state of Ohio.
You made a statement, Zach, and you know me. You said supporting people living with HIV. For that, it seems like others who are not living with HIV are doing the work. when we as people living with HIV are at these tables, are involved in every stage of the modernization. I just want to make that clear, because a lot of times we as people living with HIV are left out of the equation, and people seem like they want to save us or help us. We can help ourselves. We need a hand up, not a handout or a hand down. And I just want to make that clear to people that in all of these states, everybody on the panel is a person living with, and they have been in integral parts in each state that we're highlighting here. Timothy Jackson had another statement, a quick statement he wanted to make.
Yeah, I wanted to make it very clear. I am a son of the Deep South. I am born and raised in Mississippi, worked in Mississippi, worked in Alabama, understanding the political realities. And so I do not want to minimize the importance of that. Depending on where you live depends on really kind of what you're able to get. What I really want to stress though is don't automatically assume that you can't get something. That's really kind of my larger point. That, maybe a full repeal is not there, but don't go in expecting, crumbs. Go in asking for the most, and then you can always negotiate down to where you're comfortable. So I just wanted to make sure that was known.
Yeah, we got you. We got you on that. Go in expecting the world, and don't give up, because a lot of people, I know that you haven't been in Illinois that long, and it's amazing since that time you've been there what you've accomplished. We're gonna move on right quick. I'm gonna highlight a good friend of mine, Connie Rose from Nevada. Connie, can you come on and briefly give us an overview of the modernization?
Sure. Again, thank you for having me here. So here in Nevada, we've been working. I actually formed our listserv in 2017 with Tammy Howe of Zero Project, and began our meetings to grow our coalition. And then in Nevada, before you reform a law, you have to actually convene a task force to decide if these laws need to be changed. So the first bill our coalition helped pass was SB 284, which established the Advisory Task Force on HIV Exposure Modernization. There were, I think, 13 appointments, me being one of them, but not until later. So when the task force actually first convened, there were no women living with HIV who had been appointed, even though some had applied. Our coalition requested that the meetings stop 3 times. We asked nicely. They did not stop the meetings. So together with Zero Project and Positive Women's Network, we wrote a demand letter and sent it to the governor and the office of the governor. Within 2 weeks of that, they appointed 5 women, 2 of us living with HIV. So this task force was established in order to study Nevada laws that criminalize people living with HIV, research the impact of these laws, identify any disparities in HIV-related arrest and prosecutions, and thanks to the Williams Institute, who came on board, as well as the Center for HIV Law and Policy, Lambda Legal, Silver State Equality, we submitted our report to the governor in September of 2020. So moving forward, our bill, which was SB 275, when we established these meetings, we were focused on laws that criminalize transmission of HIV more harshly than any other disease. In our S's, that added an enhanced sentence for unlicensed sex workers who are living with HIV. As you know, Nevada is the only state that has licensed sex work, which made it a little bit more difficult, but not undoable. That actually went very well for us. It gave health departments authority to investigate and control or confine people living with HIV to control the spread, and it allowed for the segregation of prisoners based on their HIV status. So SB 275, it actually repealed Nevada's primary HIV criminalization statute, which was established in 1994 and was very, it was just like when Stephen, my founding co-chair, and I were going through these NRSs, they were still using terms like AIDS in place of HIV. They were using terms like infected. In one NRS, they actually used the term disinfect. That law made it a category B felony to knowingly or willfully engage in conduct that is likely to transmit HIV. We were able to reduce that to a misdemeanor. And if you are or can prove that you are undetectable, if you can prove you're on medication, there is no charge at all. This SB 275, it repealed statutes relating to sex workers and HIV. Those laws led to sentence enhancements for sex workers who were found to be HIV positive. So it's important to note here that in the history of sex work being allowed in Nevada, they've never actually had a sex worker test positive while being a sex worker. They have had them, of course, test positive before. This SB 275 repealed AIDS laws that allowed for confinement, and it repealed law that allows inmates to be segregated. Moving on. It also amended statutes relating to the authority of health departments. So we removed it from the penal code into the public health code, which is again important to promote public health. Another thing we did was add clarifying language to some restrictions around occupation restrictions with people with a communicable disease. It added language which makes it a misdemeanor. I'm so sorry, I already talked about that. But one thing we're very proud of here is that there's an actual clause in there that states moving forward, laws that are written must use like people first language. So we were able to actually get our champion Senator Dallas Harris, she's absolutely amazing, to write that into or to have that written into our law. And I don't think anybody else has had that success.
So when you say people first language, can you clarify what that actually means for people?
Right. So right now, like a lot of our laws still, like I was saying, still use terms like infected, or people infected with AIDS. So instead it would say people living with HIV. So it's taking out that stigmatizing language throughout the entire, like we can go through and pick and choose, because right now there are still so many NRSs like throughout the country. Every state, in my opinion, should be doing this, because the majority of these laws were all written before we knew anything about how much language matters whenever we're specifically talking about people during criminalization charges. So like we just saw with the Aubrey trial, that prosecutor, or I think it was the prosecutor, was talking about his appearance, like everything to try and dehumanize and demoralize him. So the more that we can remove that sort of language from the actual laws that are written about people, they're not going to be able to use the stigma so much. And that's what Senator Harris pointed out, because there were a few people, or assembly people, who asked very stigmatizing questions, and she immediately went right to tell them, well, it's actually that mindset that why we're here. You know,
well, I think to cut to the chase, for people who are listening, when she says people first language, that means that we're people living with HIV, not HIV positive, because we're more than just a status. We don't have a disease. We contracted a virus. We are not infected. HIV was transmitted to us, or we contracted it. So a lot of words are very stigmatizing. And what we're trying to do is remove those stigmatizing words out of our language. Also, disclosure, HIV non-disclosure laws. disclosure is also a stigmatizing word because the definition of disclosure is new or secret information. Your status should not be a secret. It is yours to share. So I prefer to use share rather than disclosure. Connie, another thing, what's unique about Nevada's law is that I read, your first time they give you a warning. Can you talk about that?
You mean your first offense?
A first offense. It seemed like I read something like they give you a warning instead of
Yes. Yes. So if it's the first time that someone has reported on you and they can prove, like through the health department, they can prove that you knew your status, but you do not have proof that you disclosed to this person. The very first time you're basically just told, hey, don't do that. However, if transmission occurs with intent and that can be proven, then the prosecutor has the option of upping that to try to get a misdemeanor. What changed was this law prevents that from going any further if you're on your medication and if you're undetectable. And those two are not mutually exclusive. So let's say that you cannot reach an undetectable status. If you're on your medication and can prove that you are virally suppressed to the best of your ability, you're not going to be charged with a misdemeanor.
When you say virally suppressed to the best of your ability, that seems to be a very
vague.
It has a very wide, yeah, very
vague.
And that was another point I wanted to talk about briefly because we got to move on. Is you mentioned about viral suppression. Is there a time frame put on that viral suppression? Because say U equals U says to have 2 virally suppressed blood work, or just 2. It doesn't give a specific time frame, like 6 months to be virally suppressed for 6 months. You have to be virally suppressed. And when we say virally suppressed, we mean a viral load of 200 and below. At least 2 consecutive blood works.
So whenever we discussed this, because I asked the same questions, I'm like, because that's very vague. Like as a long-term survivor, it's like as virally suppressed as you can be means that if you have been on your medication and you can go to your doctor and show, like, I've been taking my prescription for 6 months, a year, I've been taking my medicine because I have ART toxicities or resistance, I cannot reach the CDC, quote unquote, undetectable. But if you're virally suppressed, now Bryan, correct me if I'm wrong, the CDC has said that is preventative and helps reduce the chances of transmission. Is that correct?
Well, I think if we look at the U equals U has changed the threshold of when we mentioned undetectable. Right. It used to be less than 40 or less than 25, depending on the sensitivity of the test. Now we know that a person can have a viral load.
And
but
not transmit.
As long as it's 200 and below, because the 4 studies that substantiate U equals U say a viral load of 200 and below, you are considered to have a suppressed viral load.
Right. So that's what they're so in Nevada. So here, and I really need to say that Timothy saying that educating your legislative body it's so important, because we had some conflict within our coalition, and there was some dispute about educating and who we should be educating and who we shouldn't. So a lot of the Republicans we did not reach out to them, and all 17 of them voted against this bill, and 3 of them specifically said, had I known more about it, I would feel more empowered to vote and they didn't say it this way, but vote with the science and not so much with my bias. But because they didn't understand, so that really taught me a lot in pushing for our education team on our coalition, because I'm a new advocate. And some of the people on our coalition at the time were long-term survivors like you, Bryan, like 36 years. And they're like, there's no sense in talking to these people. They've never listened to us and they're not ever going to listen to us. And please don't heed that. That's not true at all. What Timothy said earlier about making sure that you have education days, that's important all year long.
Well, I think that is a very important point that Timothy made about you've got to educate, and the educational process does not stop. In lieu of time, we're going to go right to, thank you, Connie Rose, for that. We're going to go with Terrell Gleason. And one thing good about Terrell's report is they use their health codes. Terrell, can you come on and tell us about that?
Yes, thank you for having me, Bryan. What's going on in North Carolina is it was a misdemeanor here in the state if you did not disclose your status, if you have HIV, if you did not disclose your status or did not use a condom. And it's decided by the health department. And we really, I mean, we had a coalition. We worked with our health department back in 2016 and 17. But one thing we did differently, the legislator here in North Carolina can criminally charge people, but we kept it quiet. We had a really good, the health department, there were some senior people there and they knew this law was damaging. They knew it was keeping people out of care. So we had a really good coalition with the health department, with some advocacy organizations that were local and national. We had our clinical people in there. And then really we had the advocates. And the advocates was what the health department needed to make these changes. Our health commission meets every 10 years to update what they call here the control measures. And the senior people at the health department were ready to do it, but they didn't know how. So they reached out to the community. And also I heard some other people, I think Connie, saying how they had changed the laws or the language. That was one strong point here. We did change our language in the control measures. They were changed to what I'll call a community language. I mean, we know clinical, we know all the negative words, but we had person first, modernized language, empowering language in our control measures. And I'm lead on, Bryan.
Okay, so you said you had a good relationship with the legal forces there, and you said y'all kept it quiet. What do you mean by that?
What I mean is the health department, they're the ones who the legislator has turned over communicable disease punishment charges to North Carolina DHHS. They can come in and make a charge, but if something goes on, it's up to the health department to go to court and press those charges.
So was it all, you said it was, so prior to the health department taking over, it was always a misdemeanor. It never was a felony.
Correct. And now it's not anything.
I say that's great right there. What made y'all keep pushing to have it go into the health department? Or when you started the conversation, was it specifically to have the health department take over, or you just started open conversation and that's what y'all came up with?
The health department's in charge of it. We didn't need to talk to the legislators.
So they were always in charge of it?
They still are.
Okay.
What's going on is we had some senior people at the health department, the HIV and STI director, the communicable disease director. We had a doctor there. We had the health department attorney. They had been there a long time working in HIV, like 30 years, and they saw how the law was damaging. So and so they wanted to make some changes, but they couldn't do it on their own. They needed the community.
So, and last question, because I want to have Zach chime in on this. How does this help people living with HIV? And one would think that North Carolina being in the South would have more damaging laws. How did North Carolina manage to dodge all that stigmatizing stuff that is going on in the South?
I have no idea. Same way, I guess initially there were only 30 some states that had these laws. So we barely got swept in them with the misdemeanor. Yeah.
So do you think on a whole that North Carolina has it's less stigmatizing, or in terms of systemically and structural things that are very stigmatizing for us, say here in Ohio? So many things are stigmatizing that is systemic. Do you think that North Carolina, by the health department being so open, that they work to dismantle stigma?
No, we're not any different than the rest of the South. We had some good people at the health department. They had made a lifelong commitment. They have been around HIV. They had worked in ASOs. They wanted to change. And then they saw that the community wanted to change. And then the national, and they saw it was a trend. And to be real honest with you, what they really understood was that people were avoiding their awareness of their status. People were avoiding getting tested because what helped was that there were 5,000 people at that time in the state who the health department felt that they had HIV, but they didn't know their status. So we were trying to pull them into care in a non-stigmatizing way.
Thank you, Terrell, very much for that. Zach, I want you to come on and give a brief overview, a comparison between Nevada and North Carolina, something brief. And I also want to see if there are any questions in the chat. If someone could monitor the chat, Zach, if you can see the questions, could you please maybe bring one of those questions forward?
Yeah, absolutely. I'll do that, Brian. I'll monitor the chat. I'll give a quick overview of where Ohio's current law stands, because I think there are a lot of things that overlap right now, particularly with the way that we also want to go about modernizing these statutes here in Ohio. So currently there are 6 statutes that attach a criminal penalty to a person living with HIV here in the state of Ohio. So the one that we talk about very quite often, I'll say, is the felonious assault statute. We've talked a lot about the differences between failure to disclose in this conversation today among the states and the various penalties that had been associated with a failure, quote unquote, to disclose an individual's HIV status. How it had been attributed prior as a misdemeanor or a felony, or the modernization efforts that had happened in the past. So that's one of the statutes here in Ohio. There are also 5 other enhancement penalties. So prostitution, solicitation, loitering to engage in solicitation, harassment with a bodily substance, which we see used most frequently, I would say, here in the state of Ohio, and then also selling or donating blood. So very similarly, some of the language that was used to inform Ohio's laws, which were passed and signed into law in 1999, so over 20 years ago now, about 22 years ago, were and continued to be stigma informed. So the way that the code is written, it is not done so using people first language, which we understand is a very big, deterrent really to us being able to pass and achieve equitable public policy in the future. So any approach that we have in Ohio will also maintain people first language as well. So those are some of, I would say, the main elements. Those are the 6 statutes that we've seen used here in Ohio to uphold the state of criminalization.
Are there any questions in the chat that you can bring up? Or just comments?
Just comments at this point in time.
Okay, I'm gonna go back to Timothy Jackson about, across the country, most people believe in a repeal and replace as the safeguard. But you mentioned that the educational process was most important, and educating people, and you should not feel like a full repeal is something you should be afraid of. But like Zach said, like you said, or came back and said, it depends on where you are, what part of the country you're in, and where you are and what your challenges may be. Prior to the full repeal, Timothy, were there other discussions about other things instead of the full repeal? Or did y'all just decide, okay, the full repeal is what we're going after?
There was discussion on whether, as I mentioned earlier, whether we would modernize the law again, because there were still some things on the books that we could have potentially modernized, taking it from a class 2 felony, which is what it was, down to a misdemeanor. Potentially, it was a $10,000 fine, maybe lowering that. We could have potentially, it still prohibited people from donating blood, tissue, organ, or semen. You could have potentially removed that. You could have potentially removed people living with HIV from sharing essentially drug paraphernalia, injection tools, whatnot. You could have, you could have made some other changes to it. But again, we kept coming back to the point of, even as a misdemeanor, that is stigmatizing to people living with HIV. When we say HIV is not a crime, if you used to have a misdemeanor, to us, the coalition felt, that's still a crime. You could still be charged with a crime.
I have a question. You mentioned sharing of drug paraphernalia.
Mm-hmm.
Does Illinois have a harm reduction model that they use, or they don't believe in harm reduction?
They do believe in harm reduction. We are working on a number of different things. From right now, we're working on actually the Illinois Harm Reduction and Recovery Coalition, which I'm co-chair of, working on legislation that would make safe injection sites available, or overdose prevention sites, whichever one you want to call them. And so we're looking at that. Just made some changes to our Good Samaritan laws, so people who are there while someone is overdosing, they no longer have to worry about being criminalized or being charged by calling of course law enforcement. Of course, again, education continues.
Okay, there is a question in the chat that says, did the end of the epidemic funding, and how many jurisdictions does Illinois have that's receiving end of the epidemic funding that you know of? And did that help lay the groundwork?
No, not really. Illinois only has one federal ending the HIV epidemic jurisdiction, and that's Cook County, which is where, of course, Chicago resides. The rest of the state is really kind of on your own.
Yeah, because I think I can see y'all were doing this work well into before the ending the epidemic plan became visible in the different states. I want to ask Terrell.
Wait a minute. There was a follow-up to that in the chat about getting to zero. Is Illinois, GTZ Illinois, is our state's plan to end the HIV epidemic, and there are a number of obviously goals and strategies to fulfill that. One of a large portion, which we have found is good, we're working on trying to find policy solutions, was ending HIV criminalization. Another one was allowing PrEP to be prescribed to people, to young people, ages 12 and older, which we did in 2019. It also includes decriminalization of sex work, which we are working on. And so all of these things are helping us in the HIV epidemic, because again, if you're not talking about stigma and discrimination and only talking about biomedical interventions, we're never going to get there.
Well, thank you. Terrell, I want to hear one last thing from you in reference to, in North Carolina, when it was always a misdemeanor, were they actually actively prosecuting, or it was pretty much?
Well, there's not really that we could find, but what we were hearing is that police who arrest anybody for anything, whether it's a law or not, were using it against people to make them,
plea bargain and that kind of thing.
They were threatening it.
Okay. And I want to thank everybody for being on this call. I want to thank you, Terrell, for coming and sharing about North Carolina. I want to thank Timothy Jackson for coming and sharing about Illinois. I want to thank Connie Rose for stepping in and talking about Nevada. And everybody, and you have one last line in closing, Terrell, one last statement you want people to know in closing?
Yes, I think it's really, really important to have a diverse coalition. We did have some legal people, we did have medical, clinical people, and also for us, we ran into problems with advocates. Advocates, including me, it's me. So we had to take this group from me to we, because this group only met every 10 years. And if you're gonna hold out and get nothing, that's not a good space. Also, solidarity came in on this, and a lot of people don't even know what it means. It means you're agreeing on one thing and you're arguing on 99 others. So really, in the education piece and the language. And then the one other thing I would say about moving forward is, yes, we were led by a team of people who had HIV. We had hundreds of years experience. We were not prepared when it came to intersectionality. We didn't have people who were open IV drug users. We didn't have sex workers on our task force. And so we ran into a few hot spots where I wish that we would have been a little bit more diverse with that.
Well, thank you for that. Timothy Jackson, in closing, one last statement.
Sure. Thank you again for having me. And I'm just going to echo some of Terrell's, sentiments. Yes, we were successful, but there were some problems that we ran into when it comes to making sure that the table was completely representative of all aspects of the epidemic and all aspects of the communities most impacted by HIV and HIV criminalization. So that's something that we ran into. One thing that I would leave for you all is make sure that everything that you do, community-led, community-focused, and that you really, education never stops, ever.
Well, thank you for that, Timothy. No. Zach, one last closing statement.
Yes, we need you in this fight. We need you in the efforts to modernize Ohio's law and to make sure, yes, especially you, Bryan. We really need to start having this conversation, as you all mentioned, out in public with our legislators, with our friends, with our family, in our workplaces, to make sure that we reduce stigma and we elevate the voices of people living with HIV and make sure that we are as unified in our approach to getting these laws off the books as we can be. So thank you.
And in closing, I'm going to say is that people living with HIV and AIDS are our most valuable resources. If we're not being included, if you're not being included in your state or at the table, then bring your own table, bring your own chair, and make sure you're at the table. Like they say, if you're not at the table, then you're on the menu. People living with HIV have often been on the menu not because we're not at the table, but because people don't allow us or value our voices. We have to change that dynamic and realize that stigma exists in everything, but stigma really festers in systemic and structural disparities, like access to care. So we've got to understand that removing criminalization laws for Black people and people of color is just another thing that we're taking away that helps mass incarceration, because mass incarceration is real, and we've got to understand that. So people living with HIV and AIDS have to be the most important voice at the table. I think with that being said, I'm going to thank everybody. I think we have about 2 minutes left. Thank you for having us. Thank you for listening. If anybody has any questions, we ask that you not contact us on social media, but contact us through the Ohio Health Modernization Movement. I'm going to turn it back over to our host in case they have further comments. Thank you.
Thank you, Bryan, and thanks to all of our panelists. That was a great conversation, and I can tell from the chat that people enjoyed it and are getting a lot of information out of it. I just want to quickly thank everybody for attending, panelists and attendants included. Myself and OHMM very much appreciate sharing this kind of content with our audience. And just to give everybody a quick second reminder about our December webinar that we have coming up, that will be on December 14th, and we will be offering CLEs, and you can see in the chat that Kim has posted the title and the learning objectives and the registration. We'll give a minute for you to capture that. If you don't, you have the contact information for Kim as well. Again, thank you everybody, and enjoy the rest of your Monday.
Bye.